Hi, everybody. I'm Wendy Murdoch, and this is Webinars with Wendy. We are back this week with one of my favorite people, Dr. Erica Lacher. She was down at the Chi Institute when I went down there with Surefoot, and I was like, would you please come back and do another webinar? Because I so enjoy talking to you. And by the way, I really enjoyed, I know your lecture was like how to survive as an equine professional in this business, but you know, it was so interesting to listen to you because a lot of the concepts were not unknown to me. Story brand was not unknown to me. What was the other one that you mentioned?
Probably Patrick Lencioni.
Yeah, and Don Sullivan.
Yeah.
And so I was like, wow, that's really cool that you're talking about that. So anyway, welcome and thanks for joining me again in this cold and rainy evening.
Thanks for having me. It's great to be back.
Yeah. So, you know, one of the things I wanted to talk to you about, it kind of got sparked by the conversation that what you were talking about to the folks in there. First of all, let's just start out and talk a little bit about the Chi Institute and why you were there and what they're up to down there for people who don't know. I'm going to have Dr. Pastor talk about the Chi Institute in big terms, but I think, you know, in terms of that weekend, that'd be great.
So what I do at the Chi Institute is actually go in and talk to the groups that come there to learn about rehab modalities for horses. They come to learn about chiropractic or spinal manipulation and acupuncture. So there's a lot of different courseworks that happen at the Chi Institute. And what I do is I come in and I talk to them about how to manage the business side of that. And for many of them, they're solo practitioners, and so they're wearing a lot of hats, and it's hard to have kind of the compass pointing you the right direction to decide, you know, kind of what should I be doing, what shouldn't I be doing? Is this normal? You know, like what's going on in my world? And so a lot of my job is to come in and be like, you know, these are the norms. This is how you actually do this and earn a living. And then we tend to, it didn't happen so much this time when you were there, but a lot of times I kind of have a starting point and then we go off all different directions depending on what people want to talk about. So it's just the basics of running the business side of this.
You know, and you could apply that to barn owners, anybody in the equine world. And that's one of the things that, you know, I was thinking about so much is that so much of what you talked about didn't apply just to vets, because almost any of us that are in this business basically have not enough hours and too much to do and not enough to do it with.
Yep.
And so, you know, it was just, I'm looking at the email where I took copious notes because I was like, I need to hear this again. And I think that that's so true of just horse people in general. You know, we tend to work really hard, but like what I'm struggling with is I have my skill set I'm really good at, and there's a lot of things I'm not good at. And how do I find the person that I'm like not good at to be my second to handle all those details so I can do what I'm really good at?
Yep.
And whether that's teaching lessons, training horses, managing a barn, you know, being a body worker for horse, you know, horse body worker or whatever, I think that that's something that so many of us struggle with.
I mean, I think the first thing we want to do is, you know, we want to do it all. And the next thing we struggle with as a group of horse people is, you know, I can do it and it doesn't cost me anything. And if I go hire a bookkeeper, for example, to do my bookkeeping, then I have to pay a bookkeeper. And why on earth would I pay a bookkeeper? Because I can do all that stuff myself. I know how to do it. And it's taking it and looking at what is my skill set and how does that help me maximize not just profit, right? Because we do need to earn a living. I mean, heck, most of us own horses, and my dollars come straight through my bank account and into my horses, just like everyone else. But, you know, we need to be able to do that to the best of our ability. And the way we do that is we do the thing we do. So for me, it's being a veterinarian. For a body worker, it's being a body worker. For a trainer, it's being a trainer. And then it's finding the people who help you do the other things. And, you know, for example, bookkeeping is a big one of those. I have a ton of trainers where I'm like, if you would just send out bills on a regular basis and then get paid for those bills, the finances of all of this would run a lot smoother and we would all be a lot happier. And you would be able to do all these things you want to do, Miss Trainer, that you can't do right now. So I think, yes, it's just veterinarians that I was talking about and with, but it applies to everybody.
Yeah. And, that's the thing is there are so many ways now to make that simpler and easier, but so many people are afraid of it, right? They're afraid of like trying to figure it out. And so they don't do it. And then they wind up in that situation. No, I totally get it. I totally get it.
Yep.
But
And I get it. It's scary sometimes to give up that control, but that's where, making sure that you work on how do you have checks and balances on the system and some of that. And that's how you give up that control.
yeah, yeah. So tonight, what I wanted to talk about, which I've heard it a couple of times now this past few months, because I was AAP and I was down at Chi Institute and I can't remember one other place, but the state of the large animal veterinary world. In other words, what I keep hearing about is that we're losing vets at a greater rate than we're gaining vets, and we're in a net negative balance, basically.
We're in a huge net negative balance. Like it's massive. Like if you look at number of veterinarians who graduated a couple of years ago, there were like 35 that graduated who went into equine medicine, and there were like 75 that retired. So
Okay, all right. So let's back this up a little bit. When did this tell us what's happening and when it started to happen, and of course, why is this happening?
those are great questions. I don't have all the answers by any means. I think it's definitely a group project for sure. But there's some things that have happened over the years. And one of the things that has happened is that the profession has become largely female. And as a female, I think that is an amazing thing. But as a female, we also, and I'm using the royal here, we here because I don't have children, but we have a lot of other pressures that happen to us, especially surrounding childcare. And that's just a reality, and we also have a generation, and I'm not saying young people these days by any means, because I'm part of it, but who have come along, and I've watched my parents who worked and worked and worked and worked and worked. And, my dad always wanted to retire and travel and do the things. And instead, he got sick and passed away when he turned 70 and never actually got to do any of that. But he certainly worked a whole lot during his entire life. And so you have a group of people who are like, A, I have these responsibilities around childcare, and B, I want to be there for my child. I want to do those things. And, for me, I want to go do things, right? Like I want to get to show my horse, and I want to get to travel, and I want to get to do all the things that I saw my dad not be able to do because he worked his butt off for a whole lot of years and didn't take the time to go do those things.
So why? I mean, I'm not saying it's a bad thing that there's more women going into veterinary medicine, but why are there less men?
That is a big question overall for graduate school in general. For the university systems, there are fewer men going into college in general than there are women, and I've seen numerous things, but I don't really have a great answer on that. There is also a trend, and this is reality, right? Like I listen to far too many economic podcasts and do way too much economic stuff for fun. Like that's what I do when I'm doing fun things. Um, but the reality is that as a field gets more women in it, the salaries tend to decrease, and it's not fully understood all of the drivers of that. But one of the things that also happens is as you have less salary potential in a field, you get fewer men entering it. And so, like I said, that is a large philosophical question that I'm not sure that we have the tools to answer, but that is a bit of it. If you then add to it the crushing student debt that we have, and it's crushing. I mean, like I came out with somewhere around 80 to 100,000 in debt. My latest one came out with around 250,000 in debt. And, that's just reality. Again, so you have the crushing debt, especially in the equine world, you have some uniquenesses of horse people and the desire that we apparently are on call at all times for our clientele. So, 7-day, 24/7 kind of job. And, we have a lot of pressures from paraprofessionals trying to come in and do some of the jobs that we should do. So you put all that together. Oh, then you got to add that fewer and fewer people have hands-on contact with horses as young people. And as any horse person knows, horses are a difficult thing to just hop into and deal with, it takes years to understand them. So I think you put all those things together and you have a profession that's in pretty big trouble.
Wow. So, I mean, there's so many things to unpack in there, but it's so interesting. But let's just take for a moment the cost of becoming a veterinarian. Is what, 215,000? Is that what you said she came out with?
Yeah, she came out with around 200. It's 200, 250. I can't quite remember the number. But it's a big one. And that was her living cheaply and covering, tuition, room and board, because the problem with vet school is you cannot work while you're in, or you at least can't work enough. You can work enough to cover, some nights out, but you're not going to be able to work to really cover some dollars.
So unless you're independently wealthy, you're going to get stuck with a lot of debt, which in and of itself is going to deter people from entering into the profession. Because I mean, I have a good friend that's a vet, and she's not much younger than me, and she's still paying on her student debt. It's
Very
like
common.
It's like lifelong. And the cost is simply just because it's expensive to run vet schools. Is that?
That's a little bit of it. It's expensive to run vet schools, but all of the university system has experienced a huge increase in administration, and vet schools are no different. They've massively increased the amount of administrators that are involved in it. And the other thing that has happened is there has been much less funding from the states for, in particular, land grant universities, which is where vet schools are. So vet schools were all at universities that are supposed to be, let's do all of the research and all of the things, and then let's take that research that we're doing, we're going to subsidize it, and then we're going to put it out there for the good of the country. And at least in the United States, that funding has been whittled down and down and down and down and down for those land grant universities. I'm sure it's hit them all, but like I interact with the land grant one in particular, and we have seen it in a pretty significant way since I graduated 20 something years ago.
So land grant colleges are like, the University of New Hampshire, University of Vermont. New Hampshire doesn't have a vet school, but UMass, the schools that are associated with the states. And that funding, is that federal funding, state funding? I mean, is
Yes.
this something that we could go to our state representatives and say, why aren't you funding our land grant colleges that provide us knowledge and information and student, professions?
Yeah, absolutely. And I hear, and I sympathize to some extent with the crowd that is like, well, why'd you take on all that student debt, and we shouldn't forgive it. But I think, taking a moment to really look at where student debt comes from and how it arises and who gets created out of that, I think is really important before you kind of say, oh, we should write off student debt. But I think absolutely looking at, how can I go to, my local person. This is something that at the state, the more local level this is, the bigger voice you've got. And this is something that at the state level, you can go to your state representative and say, like, hey, why is this funding getting taken away, and how do we rectify this? And it's important to me. So, letting your representatives know that it's important is a big way to get them to pay attention.
So, and maybe this is an even bigger question, but as a whole, our concept of agriculture, more people live in cities, more farmland is disappearing to housing developments, but the backbone of the country is that you can feed it.
Yep, absolutely. And that's, again, it's where talking to your local representation to say, like, hey, this is really important, and this is why it's important to me.
So how long has this, or maybe I can ask the question a different way. Has COVID radically affected the veterinary educational system and the costs? Like, is this something that's just really jumped up in the last couple of years? No, this has been going on.
has
For
been
about,
going on.
for like, has it been a steady decline or is it like a pit? We just,
Yeah, it's been a fairly steady decline. You know, like even when I graduated, again, longer ago than I like to admit, but I graduated in 2001. And at the time, you know, certainly I had to kind of look out there for jobs. I was able to find one readily, but I had to do a little bit of work. Um, you know, and it stayed sort of that way, certainly through 2008. The big economic issues of 2008 caused a lot of people to jump ship and go from large animal to small animal. Because you know horses, especially, you know, I'm close to Ocala, and the race horses in particular are a business,
right.
and a lot of the owners of those horses own them as a business, and a lot of them are in the financial sector, and they basically cleared out barns and never came back. And so you had a lot of veterinarians who were sort of shocked, you know, by what happened there. Around the same time, you had the rise of corporate ownership of small animal clinics, and where I can offer a grad, I'm going to start you in, you know, the $120,000 range. The corporate will come to them and say, we're going to start you in the $200,000 to $250,000 range, and we're going to give you an $80,000 or $100,000 sign-on bonus. So, you know, you have sort of the difficulties of being an equine vet in terms of, you know, your owners and their expensive animals, and then you have the rise of corporate on the side of small animal offering very, very large salaries. And then you have just the nature of equine practice, which we can get into next, but you have all of those things happening. And so the pressure is on, you know, why would I go into the job where I make less, work harder, and I'm less appreciated?
Yeah, no. And 2008, I mean, I know what my teaching business and what I was doing before 2008 and what things never came back. Like I used to go to Dr. Clayton's and we do 4 days of equine biomechanics at her lab. Never came back after that. Other things like that where I would do like special clinics and things. And even my own teaching went from 4 days to 2 days and maybe 3 days, if I had a private lesson day, never back to the 4-day clinics that I used to do prior to. So there was that huge change that happened back there, and it affected a lot of things. But, I hadn't thought about like Ocala with the breeding operations and the guys just selling out and then being done.
Yeah, I had a vet that I know in Ocala, and he, you know, they're a very different world than my world, but he had 6 clients. That's it.
Yeah.
And they were, you know, training centers basically. So he went to the one farm one day, and the manager came out and he said, "We've been told to sell everything." So, you know, he had 5 clients a month later.
Wow. Yeah.
Yeah.
Wow. And I did not know that the small animal clinics were offering signing bonuses and that sort of thing to steer people into, because there obviously is a lack of small animal vets as well as large, just vets in general then.
Yeah. And that, you know, some of it is, you know, that's sort of a different side of this conversation. But one of the things that we are having trouble with is retention of practitioners in there. And you know, equine, I think the big problem is the pressures that we face, and there's some things that as owners you can really do to help us with that. But the pressures that we face as veterinarians in terms of the 24/7 lifestyle, you know, the cost pressures, a lot of those sorts of things will then take us and drive us to small animal.
Right.
There are also then the pressures on small animal as well. And so we have sort of a crew that gets into the small animal then. And most of the equine people, I will say, once they go to small animal, they stay there. They very rarely come back, but they also stay veterinarians. But you have a group of small animal people who start out there, and then, you know, they can't necessarily handle the pressures that they're being faced with as well. And so they leave veterinary medicine altogether. So we have a really horrible 5-year retention across the board.
Wow. Wow.
Yeah.
What's your suicide rate like?
It's a good one.
Yeah.
Yeah.
I mean, because that's the other thing that
Yeah.
I think veterinarian ranks up there as one of the highest.
Yeah, we're pretty high.
If I recall, which is also shocking actually when you sit down and think about that. You go into this profession for love and you wind up, not being able to survive it. So it just kind of tells me that, this is not sustainable. What we've got right now is not sustainable. And if we don't start doing something soon, not only is that going to be a problem, but the care of horses and the ability to keep horses and have horses in our lives is going to be dramatically affected.
It will be. And that's like, we see that right now. And I'm not in Ocala, but I'm in a relatively veterinary dense area. But if you're in certain parts of the world, the United States certainly, but the world especially, then you're having a lot of trouble finding a veterinarian, and you're having to get creative.
Is this phenomenon worldwide?
Yes. Yep.
It's not just the United States.
No, because horse people are horse people the world over.
Right. And so, someone, well, let's just take the United States, for instance, somebody living rather remotely. Well, I have an example. I have friends out on Martha's Vineyard, and they have horses, and they don't have a large animal vet on Martha's Vineyard. And so if they need a large animal vet, they have to take a ferry and come over. If there's bad weather or whatever, they can't get there. They can't get a vet.
And that's, so the problem in some of the, so again, I'll take my area as an example. I'm in North Central Florida. So like if you do Florida, I'm sort of right here. And my area has quite a few vets, but if you go west of me, starting maybe, I would say go west of me about 20 miles, there isn't another vet from there for probably 100 miles that will see a horse or a cow. Yeah. And this is Florida, right? Like, we're not,
right.
Nothing about us is particularly
right. And you have a lot of cows.
Yeah.
Well, it hadn't even dawned on me like cattle, because obviously they're a large animal. Obviously they're under the same pressure. And obviously that's going to be a huge, huge problem. So someone is saying that they have another difficulty with large animal vets in Quebec because they have to be able to speak French and pass a French exam, even if their clients are English speaking.
Yeah. And we all, like, I get it. We all have sort of our protections. Like Quebec loves their French and they want to make sure they have it. So, I get it where they're trying to do that. But the catch is that as we get fewer and fewer, it gets harder and harder to meet some of these expectations. So, certainly I think working with your veterinarian to have, on our podcast, we always say we want to make sure that you've got a great relationship with your veterinarian. And so we can talk a little bit about what that means to have a great relationship with your veterinarian.
Oh, yeah.
And for me, it doesn't necessarily mean that it's like, I will work on how I have a great relationship with you, even if you live far away from me.
Right. And that's really what I want to go with this conversation but I want people to understand that there are huge, so often we kind of think, oh, they're a veterinarian, everything's wonderful. And it's like, no. Yeah. So if we can understand what the conditions are for the person that we depend upon, then and then we can understand what we can do to make the relationship work better. And like I just saw a vet I was up in New York State, and a lovely, lovely person, but she stopped doing emergency care. She's going to go just strictly into rehab. And getting called out in 2-degree weather in the middle of the night for a colic is yeah,
and here's the deal. I'm not going to say I enjoy getting called out in 20-degree weather, which is what we'll have for a colic in the middle of the night. But if you are a regular client of mine who helps me make sure my doors are open the rest of the year, you have gotten your vaccines from me, you have discussed routine care with me for your horse, you have used me as a resource and been there for me, I'm going to be there for you, and I'm not going to be salty about it. Like, it's going to be okay. Like, I will be like, I cannot believe your horse picked tonight, but let's do this thing, and we're okay with it. We never mind the emergencies for the person who is there for us the rest of the year.
All right, so let's talk about this then. Yeah, in other words, it's a two-way street, right? You're there to provide a service, but you're not there to get abused. The client's there to have a service, but they're not there to either be gouged or run over or feel less than, right? Okay, so how do we have a good relationship? How do we form one? How do we keep one? What is the key to making it? First of all, we have to understand the huge pressure you're under. If you got that kind of debt coming out of school and you're just starting out, I think the other thing we have to recognize is if you're just starting out, you're not going to have all the answers necessarily in the beginning because you don't have the years of experience. You know, experience is such a good teacher. So tell us about that.
Well, you know, for our practice, there are 5 of us that practice in the practice, and we rotate emergency call. And to some extent, if you're urgent, so you call in the morning and, you know, let's say you have something that needs to be seen that day, maybe not necessarily colic, but like an eye where we want to see it that day, but it's not like we have to drop everything and run to you. Then, you know, that the ability to allow me to send any of us to that call is huge. And we will, but we get a lot of pushback on that. You know, I get the client who's like, well, I only see Dr. Lacher, or I only see Dr. Carter, you know, and we understand that and we will try to accommodate that. But on an emergency situation, we're all good veterinarians. You know, we can all come and handle anything you've got. And you never know, like, you've never met Dr. Carter. Maybe you're going to like Dr. Carter better than you like me. She's fantastic, you know? So I get it. As horse people, we're sort of like, no, I don't know who that is. They're the new vet. They can't possibly know anything. But it's just not true. So, you know, being willing to be open to different relationships with different veterinarians within the practice your veterinarian has is huge. The other thing that more and more of us are going to is, for example, I have a clinic, and if you can get your horse to me, I can do so much more.
Mm-hmm.
I can get you in faster. I can do a better job seeing you. I can, in many cases, charge you less. Like, we flat charge you less because we don't have a trip fee if you come in. You know, all my equipment is there, so I don't have to be like, oh, I didn't put the blah, blah, blah on the truck today because I didn't think I'd need it, and I can only fit so many things on the truck. But if you're at the clinic, I have all the things I need. I have all the staff. I have a warm, or more importantly for us, a cool place to work. I've got great lighting. You know, I have all of those things. So you bringing the horse to me helps me out so, so much. The number of times I hear, but you're really far away. And I go, but it's the same the other way.
Yeah. Well, and you know, all those hours that you're spending driving, you're not seeing horses. Whereas if they bring the horse to the clinic, you can see so many more horses and therefore service many more people who don't have a vet.
And it allows us to bring those costs, you know, basically the efficiency model, you know, like I can bring costs down. The more of them I see at the clinic, the better I can do all the way around for my clients and patients.
Right. Right.
So, you know, there's that. And then, you know, there's more and more, like your friend who's just not even going to do emergency at all. There are more and more people who are saying, like, as a veterinarian, I don't have to come see you if you aren't a routine client. So because you aren't a routine client and you're calling me at 2 a.m. with a colic, like, I'm not coming. I don't know who you are. I don't know that you're going to pay me. I have no idea what I'm driving into. You know,
yeah,
I'm not coming. So as a horse owner, setting up that relationship with a veterinarian when you need vaccines, when you have a question about feeding, you know, any of those sorts of things that you have, instead of asking Dr. Google, ask your local veterinarian.
So developing a good relationship with your vet is number one.
Yep.
Being
Paying
willing, say again?
Paying them.
Well, I was going to say, you know, like, there's so many more easy ways to pay somebody these days, whether that's Venmo or PayPal or whatever. There's no reason that the vet should have to wait for their payment if they have already done the service. I mean, do you, when you go on a call, do they give you a credit card that you run right there when you're done?
Yep, 99% of my patients do. Again, it's something that when I go, I very rarely cross down into Ocala 'cause it's a whole different world down there. But you know, when you go into Ocala, a lot of that area doesn't work that way. And I get a lot of pushback on, you know, what do you mean I have to pay now? And I'm like, well, you don't get to go get an Uber and not pay for the Uber. Like that's
Right.
not how that works. You don't get a veterinarian either without paying for the veterinarian. So you know, I have some very, very, very good clients that I do a lot of work for, but even those, we have a credit card and we run it at the end of the month instead of when we're out there 4 or 5 times a week.
Right.
So, you know, definitely, you know, being paid for that and understanding that I promise you, I am not price gouging you. I am attempting to cover, you know, my livelihood and make a living doing it.
Right. I
Uh,
mean, it's got to be sustainable or you won't be there. That's,
right.
you know, I think that word sustainable is something that we need to think of more and more in terms of the longevity. We're become such a society of instant, but we have to think the long term. And if you know, um, if you think about the life of your horse, and horses are now living into 30s and 40s, that's not unusual that that when you get your horse at 4, you want him there at 40. And so it's a long-term relationship.
Yeah. And as Kathy says, she's got a message in here about she has friends who organize. And we love that. We have an area we keep trying to get them to do that and we can't get them to do that, but I will I will help, I will facilitate, I will do whatever I need to do to organize that to help make it easier because yeah, I love a day when I can come into a faraway area, I can provide the services they need, but we make it efficient for everyone involved. Where I can't do it, I cannot do it. Is if I go out there, I can't go out and pull a Coggins. And that's it.
Right.
Yeah. So that, you know, that relationship, that's one way you build a relationship. The other way is, you know, not checking Google first again, but you know, calling your veterinarian and saying, "Hey, this is what's going on." And I really don't mind if my clients say, "Hey, I like I had one earlier today who was like, I checked the Google and this is what it said." And I was like, "Well, you know, the Google sort of got it right, but not really. So let's talk about what you read and then let's talk about what's actually going on." I don't mind pre-research. I just have to you have to come at me with an open mind for what I have to say as well.
Right.
Um,
Not telling you what you're going to do because of something you read.
yes. So making sure that it's a relationship with your veterinarian of, you know, a discussion, a back and forth. And I'm not saying that you just blindly say yes to whatever your veterinarian says, but that you take their knowledge base and factor it in to what you're doing. Because what you as the owner bring to the table are all of your own concerns that you have. You've got hopes, dreams, fears, goals for this horse that I don't fully understand. You know, like maybe it's that you really, really, really want to go to this horse show in 3 months. So what do we need to do that? And then we can figure it out from there. Or your most important goal is that you don't care about any horse show, but you want this horse to be as happy as it can possibly be for its entire life. Well, that changes what we're going to do.
Right.
So, you know, having that back and forth with your veterinarian about what's going on, really important. And
Well,
then being, sorry, go ahead.
go ahead. Well, I was also going to say, not only in terms of that, but in terms of the individual's financial position. In other words, you come out and tell me this horse needs to go for an MRI, and I'm like, I can't buy groceries, right? I mean, it's not that we shouldn't have a horse if we're in that situation, but being able to talk with you openly about what alternatives are there for me, because right now this is my situation and I love my horse, but I can't do that.
Yeah, and so what often happens, and I absolutely understand how it happens, but I come and I say, "Okay, I've done all these things. Now, like the only way I can really get you an answer is we need an MRI." And I need you to say to me that that's not an option and be okay with that. Like I'm okay with it. So, we're just going to say, "All right, we can't get an MRI. We're not going to have an answer. So don't expect me to use my imaginoscope to suddenly figure out an answer here." But, you know, that's okay. But we're going to work through this a little bit differently and it's going to involve patience on your part. But if you don't tell me that an MRI isn't an option and you know, like we're just yelling at each other, that doesn't help either. So, you know, I really want all of my clients to tell me, you know, what is and isn't an option and how do we move forward from here. And I will then work on saying, all right, then let's go this way, knowing that, you know, an MRI is something, but let's talk about an MRI so you really know what it costs, not that you have some guess in your
Vague idea,
mind of how
yeah.
much it costs. Yeah.
So, do you find that people uh feel insecure about talking about their financial position when you come out and look at a horse and say this is what we need to do? Or do they just not discuss it? Do they just suck it up?
Generally, I find, especially with new clients, and we are one of the few practices in the area who will see emergencies for non-clients. But generally, I find that if I am crossing a financial line that they can't afford, I get yelled at.
Okay, that's how you know.
Yep. So when someone starts yelling at me, I start saying, "Whoa, let's talk about what your concern is." And like I said, I understand all of that, right? Like I absolutely adore my horse. I turn into a 12-year-old child around her and want to put glitter and hearts on her, and I'm not that kind of person. But
No, you're not. That's why I'm laughing.
I adore her. And, if you told me I had to do something and I was like, well, I can't afford that, I would be like, oh my God, this is crushing. I can't do what I need to do for this creature that I love, right? So I understand where the anger comes from, but you gotta talk to me and you gotta work through it, and we'll work on an answer together. But I think so. The first thing that happens for me, like I said, is if I'm getting yelled at, I'm like, whoa, okay, back up. What's the holdup? Like what's the hang up here? Let's really talk about what that is. And normally I say, like, is it finances? And if it is, that's okay. I understand horses are expensive. Especially when we start talking about colic surgeries, we're in the $10,000 to $12,000 range for some of these bad colic surgeries. That's a lot of money.
Oh my.
Yeah. And I understand that that may not be the answer for you, but yelling at me isn't the right answer either.
Well,
So
I think, it's fascinating that you have figured out the connection, right? I don't know how many we all have different personalities. I don't know that I would have necessarily been the personality that would have gone, oh, you're yelling at me. That means that there's probably a financial problem here. So do you guys get training in that?
no, no,
No, I
that's called
didn't think so.
life.
Yeah, I
Yeah.
think so. But it is so it's so difficult when you're put in this position as an owner between, these are my finances for my family, and this is my horse that's in trouble. And so that's really, I want to commend you for figuring out the connection, because I don't know that I would have ever put that together and been able to then back off and go, oh, let's talk about what's really going on.
Well, if it happens often enough, I can learn.
Yeah, but I just wonder how many other vets wind up in that position and don't quite, the clash of personalities doesn't quite get to the answer, and everybody's left feeling unheard, I guess.
Yeah, and that's, so one of the difficulties there, for example, when we were at the Chi Institute, a lot of those people are solo practitioners.
Yeah.
And that is a hard life. You're an island. You're an absolute island. And one of the benefits that I do have in the small group practice I have is that we are all very, very, very supportive of each other. And, so again, if you've got that solo practitioner in your area, knowing that they feel like an island and having support, even if it's the tiniest thing, like, hey, thanks for coming out and doing the vaccines today. It was great. Those are the kinds of things that keep them in the profession. And also figuring out how you as a horse owner can support them in ways that maybe they haven't thought of. So for example, the bringing groups of people together into an area, if your solo practitioner in the area doesn't have a clinic, maybe you've got a barn and you've got this space and you've got the ability to organize that, and you can do that for them. That is a tiny thing that shows that practitioner that you care about them and that you're there to support them, not just when you have a colic at 2 a.m., but also on a day-to-day basis.
So what's the percentage of veterinarians that are solo practice? Is there a number? Does anybody know?
AAEP probably has it, but the last time I saw it from them, it's in the 40 to 50% range that are solo. Then there's a large number of us that are, maybe 2 to 3 doctor practices. And then it goes up. There aren't a lot of, when you think of the big names like Rudin Riddle, Hager McGee, Palm Beach Equine, those are big group practices. there aren't a lot of those. There's sort of one or two in every state, but the rest of us are somewhere between one and four. And I'm sort of, so I say I'm 5 veterinarians. I'm actually 4 veterinarians. I had to do a little math there because I have 2 half veterinarians that equal 1. And
Is that,
that's
I was going to say, are there part-time vets? Are there substitute vets?
so in the equine world, it's really hard to get relief veterinarians. In small animal, you'll have someone who comes in for the day. In equine, that's a lot harder because you have to come into my practice for a 24-hour period. So, if I'm bringing you in for relief, I need you at night too.
Yeah.
So that is a lot harder. We have an agreement with another veterinarian who's close to us. She actually doesn't cover emergency call for us, but she comes in and works 1 to 2 days a week with us. And then we also use her. She's a podiatrist as well, so we do a bunch of podiatry cases with her. But she gets to do things that are not podiatry that way, and so she likes to have that break where she's not doing just feed all the time. And we get to have her kind of on speed dial for all of our weird podiatry stuff, so that's really great. And then one of my other veterinarians, for various life reasons, wanted to work 3 days a week, so she does that and then covers call once every 4 weeks.
So, basically in some cases, there's flexibility in the schedule working through a clinic because you've got relief and coverage and you can do different things. It seems like there's a lot more vets that are specializing. Maybe it's just my experience lately, but specializing in certain areas like podiatry. Is that is becoming more common, less common?
It is becoming more common. One of my caveats on it is, for example, if you are pulling in a veterinarian who does only dentistry or only chiro and acupuncture or only, podiatry, it's even more important that you make sure that you also have a good routine relationship with a veterinarian, because you are then not using them for those things. And in many instances, you're taking some money out of their pocket. So you need to make sure that you are working with them on finding those specialists and not against them.
Oh, that's a really good point.
Yeah.
It's sort of like a referral system as opposed to just going over here and then calling you when oh, now I have the colic.
Exactly. Because like I said, we don't mind emergencies. What we mind is that you have never, we had one today. The horse is 20 years old and has never seen a veterinarian until today. Yeah.
Oh.
So
okay.
I'm sure that he has probably needed some veterinary services, and based on the way his mouth smelled today, he needs some veterinary services pronto. But they were like very proud that he'd never needed a veterinarian. Well, again, they're lucky that they caught us. And if we are slammed with our own clientele, like, we're not going to go see that horse because they haven't established a relationship with us. And so they go to the very bottom of the totem pole. And this is where the suicide rate comes in, right? And it's because there is nothing I like less than saying, I know your horse is colicking. Like, I can't go see it. Like, I simply cannot do it. There are not the hours in the day. I don't have the bandwidth. Like, it cannot happen. And, I know that means there's a horse out there suffering, and that is not an easy thing for me as a veterinarian to do.
Got it. Yeah, I hadn't even thought about it from that angle. That you're knowing that an animal is suffering and you're also knowing that you can't go and service it.
Yeah.
So that's really tough. So I also, what I have heard, and I'm hoping you can confirm, deny, or whatever, that there are corporations now that are starting to buy up large animal clinics the way they've been buying up small animal clinics. Is that true?
There are limited numbers of corporations that are going in and purchasing the large animal clinics. Yeah, Haggard is actually owned by a corporate group.
To what end in terms of this bigger picture? Is that a good thing, a bad thing? Is it good? We don't know thing?
There are some good things that happen with it in terms of they come in and can offer very generous benefits packages. In some ways you can come in and say, all right, I pay a certain amount for ultrasound machines, for example, or even vaccines. And they can go in and say, well, I buy 100x number of those things. And so I can get them for significantly better prices because we buy bajillions of them every year versus, Dr. Lacher buys one every 4 or 5 years kind of deal. So, from that standpoint, it helps. The problem when you have corporate come in, and I will happily put my opinion out there, and sometimes I probably shouldn't, but here we are. You only have human medicine to look at to see what some of the issues are with corporate medicine. And it is that no longer do I get to say, okay, there is that horse out there that those owners haven't seen a vet for 20 years. And, maybe I'm going to take it upon myself to go do it. And, I'm going to make some of those decisions to do the things that I want to do. I don't get to do that anymore. And there are also expectations on the earnings from that practice. The corporate group isn't owning it for fun.
Right.
They're owning it because they need to extract dollars from it. And that's fine and dandy when things are going fine and dandy, but it doesn't work as well if we hit a 2008.
Right.
So, I think just look at what happens. I go see, I'm the worst at a human doctor. And, you don't see a doctor anymore. You only see physician's assistants. You see them for 10 minutes. You run through and you're like, oh, okay, I had questions, but I didn't get to ask them because I had 10 minutes. So, I think looking at some of that, hopefully veterinary medicine can avoid it, but there are some issues that are coming up in small animal practice that certainly are similar to human medicine. And it's basically that you want that salary. It's not for free. You gotta earn the money, and you gotta earn it somehow. And sometimes it means that things get done that don't need to get done.
And do you think, like in human medicine, we're going to have more, the vet techs are going to be doing more and more because there's fewer like, how are we going to solve this problem?
I don't necessarily have a problem with more paraprofessionals, like veterinary technicians. There are some things I wish my veterinary technicians could do right now that they can't. They're simply not allowed. I have to do them. For example, like I have to pull a Coggins. I understand why I have to pull a Coggins, and it has to do with some regulatory stuff, but can I be standing here? And like, can I be nearby and watching that I know the Coggins was pulled? Like it's still my license at the end of the day on that Coggins. So, I think we're going to see more and more of that sort of thing happening. The other thing that I think is a really positive thing, especially for us horse people, we've been doing it forever, but is telemedicine. That will allow you, used correctly, that will help you use your veterinarian, not have it cost as much, and not necessarily miss out on things, but also, have a happy veterinarian at the end of the day.
So
Right
basically,
now,
I'm at my horse. I have my phone. I call you up and go, can you look at this eye and see if I need to bring him into your clinic? And I show you his eye and you go, oh no, that's fine. Just do this. Or, oh yeah, bring him in right now.
right. And so a lot of it is actually not just that, but also like lameness evaluations. To some extent, I do better on those with videos. Like I want to see, I want to do the thing, and then I want to have you go out and do what you do with your horse. I want to see it jump around. I want to see it run a barrel pattern. I want to see if did we fix it and it actually got fixed, in your horse's job, not just because I trotted it in a straight line kind of deal.
Right.
So I think that happens right now. At least it happens a lot to me. But we've given it away as a profession. And I think valuing that you are asking your veterinarian's opinion and you're asking for them to use, kind of what they do, and being willing to pay for that service is really important.
So it makes me wonder, have vets ever tried a model where it's like a monthly subscription, and then if you do need the vet, you don't have to worry because you've had them on a subscription basis?
I don't know anyone who's 100% doing that. there are probably people, I know there are people out there, in particular in the lameness realm, that are doing something similar with telemedicine, where, you know, like sort of they're on retainer and you can send in video. But I don't know anyone doing that specifically. And if, I mean, if there's an interest, I'd be all for it.
Yeah, I'm just, you just kind of think of like, I personally don't like like QuickBooks is always trying to push me into a subscription, and I'm like, I've avoided it as best I can and I'm still avoiding it. But there are times when it, like if there's it might be a way to do it. It's a subscription base. And so, you have this income coming in, whether or not you go out there 10 times or one time, and hopefully it's one time and not 10, but then the costs become more known to the client as well as the income to the practitioner.
Yep, absolutely.
Yeah.
Yeah, and we're working on some of those things, but as you know, horse people are a traditional lot.
Yeah.
So if your veterinarian starts to throw some of these things at you, if you can be receptive to them and not start with, oh no, in my day, then that is very helpful to us too, to say like, hey, we let me give it a try and let's see how it goes. And then, again, having that conversation with your veterinarian about, oh, this is what I liked about it, this is what I didn't like about it. So maybe we can tweak it from there and figure out what makes sense moving forward.
Right, because if we don't start thinking out of the box with the crisis that we're facing, with the number of veterinarians decreasing at the rapid rate that it is, you're either going to be faced with no veterinarian at all, and then you're like in big trouble. If there's something that happens, it's a big beast to deal with. I mean, it's not like
It is.
put the dog in the car and
Yeah.
So there's that piece. And I also know that they're trying the other types of services that, for lack of a better word, body workers that are available. In Europe, a friend of mine is a licensed animal physical therapist, and in this country we can't even use that term. And so, the vet will make a diagnosis, but she goes out and works with the horse to do the physical therapy so the horse recovers, right? Because the vets, quite frankly, I don't think you have the time to do the physical therapy. So that's another bridge that we need to figure out how to cross, to have qualified people able to do work that's needed to keep the horse healthy and not have the recurring lamenesses because they're being monitored and doing the things they needed.
Yeah, and absolutely. And that's part of the wild, wild west of it is, there are so many pseudo professionals out there. And, when I start asking like, what are your qualifications? And they just, they don't have them. They don't understand, horse biomechanics, but yet they're out there doing, massage and PT kind of stuff. And I'm like, well, you don't understand what you're doing. Like you're stretching these horses, you're doing it wrong, like you're counter to what this horse needs, or you haven't even discussed with me like what I found on the horse. So we need to be a group. And that's, I have the people that I work with that I think are really good, but it takes a lot of kind of working through them and being like, are you good?
Right.
Let's work on a case together and see what comes out of your mouth and how it all works. And then we move forward from there. And they feel the same way about me. Like, I get it. Not all veterinarians have a clue what they're talking about when it comes to some of that stuff either. But, I think it's the more we work together, the better it is for the horse. And at the end of the day, I'm in it for the horse. So
Right,
I'm
right.
always trying to make it better.
Well, and that's the thing is there are a couple of schools, there's like 3 to train people to be qualified, but there's a lot more people out there doing stuff, and it's all over the map.
Yeah. Yeah. And Kathy said that the video analysis sounds amazing because we can use slow motion and catch all the nuances. That's exactly, I love video for lameness evaluation and for performance evaluation in general. I can watch that turn 5 times. I can slow it down. I can zoom it. I can, like, the older I get, the more I can zoom it. Like you can do all the things to see all the things. And it definitely lets us do a better job. And again, it's where, I need that appreciation from the client that that's what I'm doing. Like, that's the work I'm putting into it. When you get pushback there, it's a bit demoralizing. It's like I just spent 45 minutes looking at videos, and then I got yelled at that I charged for it. So, again, it's having that conversation and having that level of appreciation.
Right. And that's the kind of thing where I could see it like a subscription service of, you want me to look at your horse? You want me to look at your horse every month? Fine. It's this much for me to look at your horse every month on a video, and you send it. Right. The other piece of it is, I recently was, I knew a horse that went to a clinic and came back with a prescription for the exercises the horse was supposed to do. But the thing that I found most fascinating when I read it is that there was no clear instructions on how to accomplish what was being stated. And so I was like, wow, if this was any other person who brought this horse back, I know this trainer, I know she's incredibly intelligent, but the average person getting that sheet would A, not do it, because B, they can't figure out how to do it or what to do, or they could do it badly.
Yeah, and that's where the more we're a team on that sort of stuff, I think the better it all goes for the horse.
Yeah. So it's really, there still feels like there's these gaps between like you could do, like, here's a video of how to do what I'm talking about, so that the client knows what it is and can do it safely with their horse, versus either not doing it or getting somebody to do it that's not going to do a good job. There's still a lot of gaps in here, I think.
Yep, there's tons of gaps. Yep. And I think it's, as a horse owner, it's making sure that you don't fill that gap with any random person. I think I always say, sort of start with your veterinarian and say, do you have someone who can help me do this? If they don't, then I start going to the people that I work with a lot. I go to trainers that are respected and I say, I'm looking for someone who can help me do this. Like I have and I know it's not every veterinarian, but if you start kind of going around to trainers that you trust, veterinarians that you trust, farriers that you trust, like word gets out on who's good.
Yeah.
And I think it's cross-referencing them. So, if your farrier tells you someone, you go to your vet and you say, hey, do you know this person? Does any of this sound reasonable? Those other people that are in the realm that can help you do what you're trying to do.
Yeah, no, and I think that it sounds like you have vetted the options in your area
Thoroughly.
so that you can come up with good recommendations. But there again, it's having that relationship with you as a veterinarian that can say, I have seen this person, I know this one, they're safe, go work with them, or they'll, fit with what's going on with your horse and that sort of thing.
And for God's sakes, if your veterinarian says, please don't do that, listen to them.
Well, this has been really interesting. So in many ways, I kind of feel a little discouraged just due to the lack of veterinarians coming in. So what if there was someone watching this webinar that was interested, like in young, I thought the other day, oh, I should go back and be a vet. I'm like, no, honey, you're way too old. They wouldn't even take you, even if you
think about the debt load first.
Yeah, really.
But no, I always say, if you want to be a veterinarian, then, go, and it may take a few clinics to find the right one, like talk to clinics in your area. It doesn't matter what you want to do. Let's say you want to do small and you can get into an equine clinic, do it. Like you got to do it all in vet school anyways. So work on a way into the profession in some way where, even if it's just volunteering, it's a way for you to get your foot in the door. There are a million different humane society, animal shelter type ways that you can start. Any of like the equine rescue organizations, starting there and being like, hey, can I volunteer? And that just gets you in the door and starting to talk to them about who is their veterinarian and, talking to that person. For me, like we take a lot of volunteers in our practice, but that's our model, right? Is that we joke that we're head of recruitment for the future. But we also, if a trainer comes to me, I've got one right now who says, I have a kid who is amazing. And so that kid is working with her, and she's like, when she can do, we have skills that she's going to learn from the trainer. When she can reliably do those skills, she's going to start volunteering with me. And so, she got in the door with a great trainer who is then opening other doors for her. And the horse world, like if you're willing to work, there's someone out there who's willing to to open doors for you.
Yeah. Awesome. So don't give up on your dream.
Yep.
And the other thing, it's, and I'm sure you know this too, is you never know what might happen. So you really do have to stay open to just about anything.
Well, and as you know, with the horse world, the other thing that happens is it is not 6 degrees of separation in the horse world. It's like 3.
Yeah.
So that person, you never know who they know that will send you to the moon, like there are so many opportunities just by showing up and doing and working hard.
Yep. Awesome. Well, I want to thank you so much for joining me tonight. And this has been just a really interesting conversation. You're just fun to talk to. And like I said, I listened to your lecture, and it had nothing to do with, it had everything to do with business is what I'm trying to say, but it's so sang to some of the things that I'm working on. And I was like, oh, I just can't wait to talk to you. Okay.
Well, thank you for having me. It's been fantastic.
Yeah, it's great. All right, everybody, just remember you can find this and all the other webinars on the Surefoot Equine YouTube channel. I think this is Dr. Lacher's second. If we do one more with her, she'll have her own playlist. So we'll come up with another topic sometime and have you back. Would be great. And do stay warm tomorrow. You got a plan? You got a plan for?
We don't do well with that in Florida. We just hunker down. You guys would be laughing at us, but we just don't.
That's what we're gonna do tomorrow. It's like I'm trying to get everything done outside before the cold hits. In fact, we didn't get the bird feeders up yet, but I got a new one. So because those poor little birds suffer so bad when it does this.
Yeah. So good luck to everyone out there with this weather.
Thanks, and happy holidays.
You too.
Okay, bye.